Good morning, everyone. Welcome to this session focused on exploring the futures of health data. This is the second day of our 5th Digital Health Society Summit. Yesterday, we talked a lot about the European health data space and health data in practice. And now we would like to also look at this and also look at what are the possible futures of health data. With me is Bogi Eliasen, who is Director of Health at the Copenhagen Institute for Future Studies. Bogi comes from Faroe Islands and studied in Denmark in University of Aarhus. He also consulted over the last decades governments and different organizations on futures of data, and also initiated the Nordic Health 2030 movement. So I'm here today with him to talk about his work and also his thoughts and conclusions about what's possible in the future. So maybe, and I also just one word, I also studied future studies. So that was when I learned about the area that you can actually study and explore futures. That was very fascinating for me to know what's in the future and how we can learn about the future. So we are here to also bring this topic to you. And I wanted to ask Bogi for the start, like where this fascination of the futures came in your life.
Thank you so much, and thank you for the invitation, and congratulations on this very strong program for these days. So my fascination is partly based on that when you are trying to develop some ideas, often we get bottlenecks because we don't prepare for how we go forward. And to me, it was very practical. I was working with genomics in my native Faroes with the genome project there that I also initiated, and it was quite clear to me that not only on the technical field, so what is coming on a technical, what is possible on a technical level, and on a data level, but also with the ethics and understanding, so the readiness on a technical level, on a societal level, and on a behavioral individual level. We don't really take that into account. So we have like silos or bubbles working really hard on making something possible, but not communicating to those who actually need to use and apply it and accept how to use it. So I was just became more and more aware of that. One thing is the necessity to think multidisciplinary. But then it's also, how do you fertilize the ground? How do you prepare for what is possible in that way? And that then brought me more into working more deliberately and structured with future studies.
Perfect. And would you tell us and let the audience know, why do we talk about futures, not the future? Why this session is called Exploring the Different Futures of Health Data?
Yes, and that's also luckily for me in the name of the Copenhagen Institute for Future Studies. So it is an exercise in looking at what potentials we have going forward. So not accepting that there is only one future. Part of that work, it also depends a bit on which toolboxes you use and which kind of future studies you apply. But at least the way that we use it, it is also to go in and be quite clear on what is a given. So what is the contextual environment that you need to accept? So this is where we use megatrends to say, okay, this will affect you no matter where you are and what you do. But also it does affect you differently depending on where you are and what you do. And then the more contextual environment, where you have bigger maneuvering room to actually shape what is happening in different ways. So, and this is why we are talking about different futures. So for instance, coming to the initiative that you mentioned, Nordic Health, here for instance, it's important for us to go in and look at okay, where are we today? So we all agree on that, work together. Okay, what is it? What is our status? Do we have a vision on where we would like to be, for instance, in 2030, which we set out in 2019 when we started this process? And then we have worked very much on, okay, how do we get there? And here we apply scenarios and saying, okay, if certain drivers will be more important than others. So is it more tech driven or more policy driven? Is it more driven on curing or more driven on prevention? Is it more on keeping it at hospitals, or do we give it into the hands of the people? So is it been more centralized into super hospitals, or is it going to be more home care, or is it going to be a combination of both? And with that, you then identify which, given that you have a normative or a favorite scenario you want, or a world you want to end up in, what are then the things that you need to change? Mm-hmm. And that becomes much clearer when you work with scenarios, because it also becomes clearer what are the consequences, positive and negative, of the different actions that you take.
Yeah. And do you think that COVID, all the experience with COVID, make the interest in futures and in different scenarios like higher? I learned somewhere that the companies that actually had invested in futures preparedness before COVID and had done the work with the scenarios went through COVID better than those that were completely surprised by what happened. And I think that this we can apply to COVID and also other events that happened during the last years. So do you see the growing interest in the futures?
Yeah. So I think there are two aspects of it. So one thing is, did those companies, were they prepared to what happened very precisely, because that was a part of their scenarios? Yes or no? That's one question. The other question is, if you work with futures and scenarios, are you then more resilient to changes? Mm-hmm. And I think it's more the second part, because it builds a way of working where you are ready to adapt to the circumstances that happen in different ways. And you, if you use it dynamically, you will also do horizon scanning all the time to try to see where is the world going. And I do think that there are many companies and many individuals in companies that are doing this without knowing they're doing it. Mm-hmm. Some have just built this mindset in. And then if your question is that if we had many that foresaw this scenario, I mean, there was a lot of discussion about that a pandemic would come. But I do not think that we have seen many that mm-hmm. that described it in the way that it happened. Right. In that way.
Right. Before we go further, and I would like to, of course, learn and hear more about the Nordic Movement 2030 and what is there about the futures of data, I wanted to actually show two slides that refer to what we were talking about, the mega trends and also different scenarios for the future. So I have here for our audience the first slide, which is full of, which is actually one picture and which presents the 12 mega trends shaping the transformation of digital acceleration. And one message that I have here, or what I'm taking from this slide, so this is the future of healthcare. We really see a lot of issues related to the technology, of course, e-health, connected health, user experience, digital transformation, but also we see a lot of things related to data. So we see here big data, data privacy, of course, cybersecurity, blockchain, and all other things, of course. This is that are here, patient care, machine learning, AI, virtual reality. This all is related to data and the data privacy, data security, availability of the data, secondary use of health data, and so on. And this slide shows the first scenario that we developed within the Connecting Health project that the ECHAlliance is currently coordinating, where we looked at the future scenarios of digital health in 2030. And we have here two arrows. So two key uncertainties that we explored together with different partners, stakeholders invited to our futures workshops. So first uncertainty is related to the policies. So will actually the policy enable implementation, development of the digital health solutions? So we have here low and high. And the other uncertainty is about the empowerment of the people, empowerment of end users, meaning all citizens, healthcare professionals. So will they actually know how to use, be interested in using, and will the conditions for use be supportive? So here we have 4 scenarios, and maybe I will just briefly describe them. But as you see, the flashing green is the scenario called digital health is health. And very briefly, what is in this scenario, and just to explain, we explore different topics. So health data was one of the topics. There were 9 other. But briefly in this scenario, we explored the health data. So digital health is not a side story anymore. It's the part of the healthcare system, integrated part of the healthcare system. And here, the health data is flowing through the system smoothly. Also is flooding through the across the borders. So the person can travel, move, realize their e-prescription. When they go to the doctor in another country, they get them all the care they need based on their electronic health record. And also, this is the scenario when the data is safe, secure, shared, and we have the reimbursement models for digital healthcare, but also we have the incentives for the companies, for the organizations, for the citizens to share their data. And then maybe I will just touch on for the sake of time, touch on the black hole scenarios. So this is we don't have policies, or the policies are fragmented, and also the empowerment of people is low. So this is the scenario that is where of course, data is used, data is exploited, but people don't really know and don't really have maybe that much interest or awareness what is happening with their data, how it is used. It's of course used by the big companies providing healthcare services, but this is a bit like happening not necessarily in an integrated fashion, integrated way. So those are the first scenarios that we explored. And maybe one thing that also we had some workshops with the stakeholders is to discuss which of those scenarios is preferred one. So we can assume that all of them are possible, probable. Maybe none of them will happen like fully, but some mix of them will be realized. And then the pretty like anonymous decision was that the digital health is health. This is the preferred scenario. So this is very shortly about our exploration from the Connecting Health project. And with this, I would like to then come back to you, Bogi, and maybe talk a bit more about the Nordic Health 2030 movement. You also there touch on the issue of health data business models. Do you want to comment on those 4 scenarios that you saw and also link it to your work?
Yes. So I think it's a very interesting way to push this thinking on how can the future look. We from the institute side, I mean, the institute works generally with scenarios, and then we have a big health team that works specifically with health. But our focus is also broader than digital health and data. It's the whole health space. Yeah. So we have a general megatrends catalog where the health trends we then call more like factor trends, the one that you mentioned, because I mean we go in for instance concentration of health, globalization, population growth, network economy, and then we look at from the health team what does that mean for health, because all of them are relevant for health as well. For instance, AI and automation and the new biology are also very important megatrends that are coming in. But given that, going back to that, this work started in 2019, and then the approach was very much on where is it we want to be in 2030. So given that there is a decision in the Nordics on being the most integrated region in the world by 2030, and on the back of that work, it was also concluded by the Nordic Council of Ministers that we should be the most integrated health region. How do we do that, right? And of course, data is paramount, is very, very important in digital functions. And I will go a little bit back in history also, because even if the Nordic countries are quite similar in ways of seeing things, in the ways we are being digitized with having applied digital identifier that we not just use in health, but for everything, that we can connect data in different ways, which is very difficult to do in other countries, and that there is a very high degree of trust in this way of working from the public side. And we also have mainly public health systems. That said, people get surprised when you look at the level of collaboration between the countries, because the collaboration is more informing what we do. It's not collaboration on the things themselves. So that is the part we are trying to push as well. So my personal ambition to push this forward and start in 2019 also had two other dimensions. One of them was, how do you work in a welfare society when you move from being analog to being analog and digital at the same time? So what is the social contract in a welfare society when it's not just your local environment that you work with? And my part of working is, of course, I spend a lot of time on the technology, but the main focus is on what does it lead to? What is it we are solving? So the prime question here is asking the decision makers, what do you want? The best health system or the healthiest population? So how do you put your eggs in the basket for this? The other thing which became very clear in our 2019 work was what we all see today, that the way we have constructed our health system is not sustainable. It was made for a reality 100 years ago that was based on communicable diseases and accidents. So you need to react fast when you have something. The toll on our systems today are behavioral or lifestyle diseases and chronic diseases, that connection, which will benefit very much of early detection, prevention if possible, and early interaction. So before you really see the toll of the disease. We have the technology to do that, but we applied the technology in the late stage. So we are not really getting the value of the technology. So one question is, which technology do you want to use? But for us, the first question is, what is it you want to use the technology for? Because what has happened is that we are pouring technology into a system that we are not changing. So if we look at not just the Nordics, but if we take the Nordics as a case, there has never been more money in the system. There has never been more resources in the system. There has never been more staff in the system, but still you've never had more burnout. So something is not working in the way that we are doing it. So that has been a way around thinking, okay, if we have invested so much in data, how do we make sure we use it? And if we invest so much in digital functions, where do we apply them in that way? And going back to the scenarios here is that what we have worked with now in the second part, where we're trying to flesh out, okay, how do we get there? So how do we become practical? So what is, and the Nordics cannot be detached from Europe, and especially the European Union. So there is a huge push in the European Union now on the European health data space, which we all need to relate to. It might not be realized, but it might be realized. Either way, it will have a big impact on how we go forward in that way. And that also comes into the second part, that if we want to use data-driven decision-making and learning health systems, it's not enough to keep the data in municipalities or regions or in countries. We need to connect those learnings. So this European idea, which of course you buy into, or else you wouldn't sit in that organization. It is really about how do we how do we build the space for multiple use of data or infinitive use of data? Of course, the bottleneck we always get is privacy, ownership, control. And what happens when you begin to work with scenarios in this way is also saying, okay, if that is what we want, the frames we have today will not deliver it. Okay, then how do we take that discussion? Because most of the discussion today is how do we work with data with the privacy frames that we have today? My conclusion is very clear: we can't. Okay, the privacy we have today is based on an analog world where you lock things into a bank box. And just to underscore that point is that it is estimated that we only activate 3% of the health data we are producing. Right?
In the current moment.
In the current moment.
All right.
So that's very limited. So what we, and this is where the work of for instance Barbara Prensak and Ilona Kipush with Pluto on working with the data solidarity and really go in and break down and say, okay, where is data beneficial, and if it has a harmful part of it, then how do we mitigate the harm instead of saying we can't use it because there is a risk. Right. And yeah, go ahead.
And also in the Nordic 2030 movement, so you touch on the societal contract.
Yes.
And then you also work on the new data models and business models. Yes. So do you believe that different ways of working with data is needed? Some data cooperatives or other models? Yeah.
So I do think that this concept of data solidarity is probably a way to go, because we need to both be able to share but also to use. So here we would need to really push for where is the value of data. Today we are paying repositories to just have data. So if you have a lot of data as a company, you get high value, but that doesn't provide any societal value or value to a citizen just to sit with data. So can we, and most of this data is taken from public resources on the first hand. So here is the old concept of data intent. So if it is data that has public value, common good value, you cannot monopolize it. That should be free for use. Of course, we need to have a room for businesses to work in this area. So we get the innovation, we get the application, we get the maintenance, we get the refinement of data. And businesses need to make money. I mean, that's a given. So we also need to be honest with ourselves on that part. But we also need to be better at building the playing field which we want data to be in and health to be in, because we don't have the cornerstones today. And here we really need to push for a much better private-public partnership model, which in my perception doesn't exist, because what we do are tenders. We don't really get all the knowledge or all the positive things that we could get from the companies when they are in that part. But we need to be very clear on that there needs to be an individual and a common good outcome when we then invest in these things. But the data models that we have focused very much on, and which we already started in 19, is to say, what happens if you give the individual access to own data with AI models? So, I mean, this is 4 years before ChatGPT, right? So as a thought experiment. So what happens if you do that? And we were not even saying that you need to produce new data. This was just with existing data resources that would help a person, like your microenvironment with the climate, your health data, what you eat, your longitudinal data, which might be relevant. How can you use that to help you stay healthier for longer? And that is also based on that our big challenge in the system is not necessarily that we get older. It is that we have an increased disease burden while we get older. And to me, it's a mystery why we do accept that. I mean, why don't we have a metrics where we say we want people to get older, but not to have more disease in the lifespan? But this is why we invest in technology and well-being. And then the other part, which we have tried to push very much, is how do you then combine the individual data and the aggregated data? What we have done for the last 30, 40 years is to try to optimize the system. So the system side of data, but not the individual data. And in that work, we have not given anything back to the individuals from whom we ask data.
Mm-hmm.
So, and the world going forward is really based on real-time data. So just think about the digital twins that you have in planes. They're not waiting a year before they get the data back when they fly across the Atlantic. I mean, it's real-time maintenance. And the data we have had in health have also been snapshots. But today we can do 24/7 real time to see the fluctuation of different parameters, and this will come. And if the health systems is not doing it, somebody else is going to apply it.
Right.
So the question here is, how do you do a data feedback loop that helps the individual and helps the system? But nobody is going to deliver data into a system if you don't get value back. So this is what the system has to figure out. What are we giving to the population so we actually get this?
Right. So we have a couple of minutes left of this fascinating discussion. So maybe some quick questions to you now about like moving forward and really looking into the future. So do you think that this vision for the Nordic 2030 will happen? We are in 2023, 7 years to go. Do you think this vision will be realized?
So it depends on what you mean by realized. So my way of thinking is, when you try to set out things, you have to aim for the stars, even if you know you land on the moon. You have to get the picture out. So what we set out as together as a conclusion is to go for what we call half-half, have half of the budget for prevention. So primary, secondary, and tertiary prevention. Will we get to the 50% by 2030? Probably not. But if we can move this 10%, it will still make the system sustainable.
Okay. And do you think like that it will stay in the Nordic, or can we also bring this vision to the whole of Europe or globally?
So I do think that the ones who will move this are the low and middle income countries, because they have a much bigger need, and they don't have this data legacy and are not bound in a system from 100 years ago.
And then what do we thinking about the different sectors of the society, thinking about the civil society, government, industry, and academia? What, how should they contribute to make this vision happen?
Yes. Yeah, let me really push on this one. So I think we have a huge challenge that we are waiting for the politicians to solve everything. I have a big secret to reveal here. It will not happen. We are putting too much in the hands of politicians. The role of a politician is to steer when there is a wish from society to push forward. Right. What I really, really would like to see is more responsibility from the commercial side, from the administrations, of the public administrations, from the civil society, and from individuals on what is this. What is happening today is that we are all screaming democracy, democratize, while we're waiting for the monarch. We're still waiting for the superhero to come in and do everything. So the challenges we have at hand, nobody can solve alone. It's a collaboration. It's not going to be easy. We're going to break a lot of glass, and there will also be mistakes on the way. But yes, it will go forward, if that was your question.
Thank you so much for this message. And this also shows that the future is in our hands, so we can really create and develop and co-create the future together. Thank you, Bogi, for being with us, and for our audience, thanks for your attention. After a short technical break, we will move to the session of the reimbursement models. How can we revolutionize healthcare and realize this vision for the better future for the digital health by the reimbursement models paying for digital health care solution. Thank you so much, everyone. Bye.
Thank you so much, and thank you for inviting me.